is a skin infection. Yes, actually, it's a skin infection. Their skin, you see this reddish swollen bumps that it looks like it do look like pimples, but the truth is that thing is not pimples. That's why you take drugs and drugs, it will not go away. Hello everyone, welcome to my prevention clinic at Civil Life Health Tips. So today we're going to be talking about why your next infection could be dangerous. Simply put, the silent killer. For today we'll be focusing on the antibiotics resistance. Alright, straight to the point. Take for instance, you get a simple cut or maybe a tiny cut. No big deal, right? You slap on a bandage, maybe take some antibiotics, and that's all. You move on. But what if I told you that in the near future, that simple or tiny cut could kill you? Yes, dramatic, right? But also terrifyingly real. Welcome to the world of antibiotics resistance. Antibiotics are medicine that is used to kill bacteria or stop them from growing. So doctors use them to treat bacterial infection like pneumonia or urinary tract infection and etc. But the problem now is that most of us already have these drugs at home, especially our mothers. Especially this amoxicillin, we already have them at home. Probably from our previous treatments and some unfinished drugs, just pack them up in one container. The next thing, maybe when Victoria or Amaka sneezes or she's having running nose or common cold, you hear mommy shout, "Amaka, that drugs, go and take it. I'm sure that sickness is about to come back again. Let's attack it now before it becomes a problem." So Amaka will go there and take amoxicillin because she's having running nose. Now here's the thing, antibiotics do not kill viruses like your common cold or the flu. That is where the problem begins. Okay, I'll just give you two examples of this antibiotics resistant infection that we're already suffering. So everyone knows how this TB, tuberculosis medication has evolved over time, how public health has helped in bringing many drugs that made this tuberculosis very easily treatable. But right now as we speak, treatment for tuberculosis is gradually becoming difficult, and this is as a result of what? Antibiotics resistance. Also there's this methicillin resistance. I don't know if you've seen some people, their skin or their is a skin infection. Yes, actually it's a skin infection. Their skin, you see this reddish swollen bumps that it looks like it do look like pimples, but the truth is that thing is not pimples. That's why you take drugs and drugs, it will not go away. They evolved as a result of antibiotics resistance. Now, how did we get here? Yes, one, overuse and misuse of drugs. Anytime you take antibiotics when you don't need them, opportunity to learn about your body and to adapt and to fight back when you don't finish your medication. Especially when you are sick and the doctor prescribed drugs for you. In the middle of taking the medication, you feel like you are feeling better. Most of us are guilty of this, and then we stop taking the medication. What you just did is that you just left the strongest bacteria in your system, and that gives it the opportunity to multiply. That's what I'll talk about is antibiotics in farming. Yes, in most countries, like 70% of antibiotics are used for farming, for growing their crops, for growing their livestock, and for preventing disease and more crowded animals. And because they want their animals to grow and their crops to grow faster and all of that, so the rate at which they use these antibiotics is becoming too much. When we now buy these animals, we cook them, and because most of these antibiotics, they are heat stable. Heat do not get to degrade them. So after we eat our meal, our meat and the rest, what happens is that we successfully expose our body to a low level of antibiotics compared to the kind of bacteria that is in our body. Imagine a baby trying to fight a giant. The baby will definitely fall. So the bacteria in our body will now overpower the low antibiotics that we've eaten. Lastly, prevention. Yes, how do we fight back? One, do not share your medication, and secondly, take the full course. What I mean is take your full medication. Thirdly, take a well-prescribed medication by your doctor. Then be smart with antibiotics. Then lastly, please let's support a better farming practice. So take home for today will be, for the love of science, practice the habit of washing your hands. It will help you in the long run. Thank you for listening. Stay tuned, stay informed. See you next time. Bye bye.